Not only food prices and other commodities have gone up in the wake of COVID-19, equipment and other consumables used within the health sector have. The availability of gun thermometer on the market and its prices are hurdles that some COVID-19 teams in some districts are faced with. The District Director of Health, Isaac Anobel, in the OT region, made this known during the commissioning of the Jasikan District COVID-19 Health Committee of that region. Of the 21 health centers in the district hospital there, only 6 facilities have gun thermometers to check temperatures of clients who visit those health centers. A report by Peter Seno, our correspondent for the OT region.
The Jasikan District Health Director, Isaac Anobel, says the cost of medical supplies, especially the gun thermometer, has gone up significantly from 200 Ghana cedis to 1,200 Ghana cedis. This situation, according to the director, is not helping the fight against the possible spread of the infectious virus into the district, since the health facility is running on limited internally generated fund. He also revealed that of the 21 health facilities in the district, only 6 have gun thermometers for screening.
Most of our facilities don't even have the gun thermometers we are using to take the temperature. So what they do is that they take verbal history of the person to find out. The problem is actually not getting them from the suppliers. And even as we get them, the price is too much exaggerated. And that has really been a challenge. The gun thermometer we used to buy at 200 cedis is now costing 1,200. That is actually posing a challenge. If not that, we would have been able to get one from one of these stakeholders. But we are still working on it. We are hoping to get in now gun thermometers for our various community health nurses and the staff at our peripheral facilities to ensure that this exercise is done appropriately.
Meanwhile, the COVID-19 team in the district is collaborating with traditional authorities to fish out lockdown returnees for screening. Asafwache Amankwa Boateng speaks for the Jasikan Traditional Council. He says people who have traveled into the district in recent past weeks are voluntarily reporting for testing.
We have informed all the chiefs that those things should be done in the community. At least they should be able to list the names of those who have come, identify them properly so that they will submit to the health directorate so that they can be monitored and see whether any of them is carrying the virus. Most of the people are voluntarily coming out, that they have traveled from Accra to the community, and that is even helping us because they themselves have agreed to come out that they are from that place. In Jasikan alone, we are able to get about 15 people who have arrived.
However, according to the Health Directorate, this has not been easy as people tried to hide returnees. The exercise has produced 2 suspected cases, each under self and mandatory quarantine, pending the outcome of test results from Accra.
It hasn't been easy. It hasn't been easy. When you go to the house, even after you have identified the house and you get to the house, the family members kind of hide their relatives. And but as much as possible, the communication team is on the ground. We are doing a lot of education using the public CIC centers and the radio stations to educate the people. One of the cases reported to the hospital, and based on the signs and meeting our case definition on the screening tool, is a suspect, and we have taken a sample and submitted this morning. And there's another case of a traveler, no symptoms, no signs, not sick, but because of the President's directive on getting all travelers who came from around 3rd March to date screened, we have taken his sample and submitted, but we are still waiting for the results.
Peter Senu for JoyNews.